I do have a list of questions. How should a team interpret a Schild plot slope that is not equal to 1? Um, and what's the first diagnostic step? Well, exactly. You try to get a nice range. So try to show a shift in your curve of at least 100-fold. Not don't stop at tenfold and so forth. So if you can do that, and the first uh, criteria is that the Schild plot is linear, and if it has a slope of 1, that's consistent with, but not proof of, but consistent with simple orthosteric competitive inhibition. But there's a lot of things that can change that slope even when you have a simple orthosteric inhibitor. If the Schild plot slope is greater than 1, usually that's because you haven't equilibrated your inhibitor with the receptors long enough, because rate of onset is first order, so the lower concentrations take longer than higher ones. So as you do a concentration range, the lower ones are not yet on board, and as you go up in concentrations, it speeds up, and those are on board. What that does is give you a steep Schild plot. So if you see that, simply wait longer. And now a Schild plot slope of less than 1, we already talked about. An allosteric will give you that, because the allosteric site gets full and you have no further shift, and so the Schild plot curves. Now, you may not have enough points to demonstrate a curve. All you'll see is a couple points, you put a straight line through it, which is your curve, but it'll look like a straight line that has a slope less than 1. There are also a number of other interactions, usually true in tissues, things like neuronal uptake of agonists and that kind of thing, which really are only operable in structured tissues. If you're using those and have further questions about them, we can certainly take that offline. But usually it's the kinetics and the orthosteric and allosteric. Of course, Schild plots are also showing shifts to the right of curves. If you're starting to get a toxic effect, which may kick in at higher doses, then you may see increasing shift at a higher dose. This will tend to increase your slope as well. The way to get at that would be a systems issue or a compound issue, is try to use a different antagonist. And if you see it with that one as well, that'll be a cell issue. If not, it could be something else. So those are the obvious ways. If anyone has any exotic effects, let me know and we can discuss further.
Thank you, Terry.
Right.
I have a question, and we've covered this in one of the classes. The question is, when is an allosteric modulator preferable to an orthosteric ligand for long-term therapeutic control?
Yeah, wow. Yes, now you touched the nerve. Allosterics have many advantages, and there's about 14 properties of an allosteric that can be useful therapeutically that an orthosteric cannot do. Obviously, anything that you want a potentiated response, only an allosteric does that. Fair enough. But an antagonism, there are two aspects of that. One is saturation. The nice thing on a NAM is you will get a defined effect and nothing more. So saying you wanted to, it tends to reset the sensitivity of your target. You don't obliterate it, you just reset it. It might respond maybe with 8-fold higher concentrations of agonists. So you just reset it. And thereby you don't get overdose. No matter how much inhibitor you put in there, you'll never get too much inhibition if 8-fold is okay. Then what you can do is fill up the receptor compartment with a high dose, because this won't produce an overdose, but it'll greatly prolong the action. So you can get an effect with a long duration. Whereas with an orthosteric, duration is linked to intensity. So to do that with an orthosteric, you would need a huge dose, and that might lead to an overdose. So lack of overdose is very important. Potentiation is important. So those are the main reasons why people go after allosterics. There's a whole subset of good things that can happen with potentiators that are allosterics. You can get less side effects. You can overcome mutation. You can use probe dependence to give you selective effects and so forth.